HIV has touched every Zambian home. Behind the fight is National AIDS Council.
The National HIV AIDS STI TB Council of Zambia is a development agency or a statutory body that was established by the government of the Republic of Zambia to oversee and to coordinate the response, national response to the three disease conditions, namely HIV, STIs, and TB. It serves as the central authority for the planning, resource mobilization, and to oversee the implementation of prevention, treatment, care and support programs across the country.
There are certain areas where the Ministry of Health has no strength, like engaging the communities, and the National AIDS Council really does great work around engaging the communities, and also other players like the UNAIDS, the US government, other line ministries as well. That's how we complement each other in the coordination of the HIV response. We have seen realignment in donor funds. Commitments have also reduced, and the National AIDS Council really now has to play a greater role in raising the resources. So there are areas under consideration from the National AIDS Council perspective. How do we bring in other players, the private sector? What can they contribute to the HIV response?
So in terms of the funding gaps that have arisen due to the cuts by the United States government, as NAC, we had foresight, of course, working with partners such as UNAIDS and mainstream government, being the Ministry of Health. Remember, as NAC, we are a multi-sector coordinator. So the cut itself came as a shock because we had been anticipating some kind of reduction, but not an abrupt cut. So as a way forward, we've had to engage the private sector, working with PPDF and other ministries such as Ministry of Labor. We've launched what we call private sector engagement strategy. And this is where we want the buy-in from the private sector in terms of also having a share in the wealth and the health of their employees.
What can they contribute to the HIV response? How can we lobby or advocate for policies looking at other taxes, like taxes on alcohol, taxes on other beverages, like the sweet beverages, on cigarettes as well, to raise resources for the HIV response.
New infections are growing. In the case of Zambia, we know that the new infections have increased from 24,000 to about 30,000 as at last year. And what it means is that we need a multi-sectorial approach to addressing new infections. What we have always done with the NAC is to integrate HIV into the multi-sectorial response that are being led by the ministries, departments and agencies.
And if you look at NAC, NAC has been able to impact most of our people living with HIV communities in that with the knowledge, information that NAC was able to provide, we've been able to receive a lot of information around treatment, around preventing oneself from getting HIV. And most of the communities were able to be aware in terms of how HIV is transmitted, how one can be able to make sure that they adhere to treatment.
We also work with civil society organizations who are into demand creation. And by that, I mean increasing awareness amongst the various populations that are in the community so that people, for instance, see the need to go to the health facility to get that HIV test that will be a key for them to accessing all the other services that come with that.
After activities like the Positive Linkage Initiative that was tailored by the National AIDS Council, we've seen a number of young people, or rather peers, that have come on board just to share their experiences, how things have changed in their households, because these people were negatively impacted in terms of how they were looked upon by their family individuals as well as their fellow peers. And we could see that after addressing these issues, We've seen that we've tackled issues to do with stigma.
And the other thing that NAG programs have been able to impact on our communities as people living with HIV is that as NZP+, we were engaged in terms of forming community action groups where we brought ARVs to the closest in the communities. So people were able to access treatment within the communities in their nearest vicinity.
So the National AIDS Council, in that way, complements the Ministry of Health around service delivery for HIV.
And that is why we need NAC to coordinate the actions of all the various ministries. We need a body to bring all of it together under one umbrella and coordinate it as part of our collective work to deal with HIV in the country.
So the NAC's vision for 2030 is to ensure that HIV/AIDS is no longer a public health threat, ensuring that there's zero mortality due to HIV and no new infections.
It feels nice to be part of the NAC family because it is engaging in addressing issues to do with HIV. I encourage all young people out there, all peers, in the HIV response to end AIDS. It needs to start with you.
Well, it's a joy to be part of the NAC family. It's the communities whom they serve. We jointly serve the people of Zambia, and it's a joy to be associated with the National AIDS Council.
There is that responsibility that comes with that even as I'm feeling happy to be here, I do have something to do that I need to do in my time whilst I'm here, so that when I leave, at least people will be able to see that there was a person that sat here and something was done to the betterment of all in Zambia.
My main passion has been to ensure that we've got a next generation of Zambians that are HIV-free through the implementation of the Prevention of Vertical Transmission program, where we ensure that mothers do not pass on the virus to their newborns.